Hello, we are here today to talk about history of HIV, key historical moments of a pandemic. My name is Elizabeth Miranda and I'm a sexual health advisor and HIV testing lead for BHA in the project PASH, Passionate About Sexual Health. PASH, it's a partnership between BHA and LGBTF to prevent and test HIV, and Just House Trust that provides the support for people HIV positive.
Hello, my name's India Henry. I'm a sexual health advisor and asset-based community development lead. I work for BHA for Equality. So what is HIV? HIV stands for the Human Immunodeficiency Virus, and HIV attacks the body's immune system, damaging cells and weakening the body's ability to fight infections and diseases. HIV is found in bodily fluids of a HIV positive person. This includes semen, vaginal and anal fluids, blood and breast milk. HIV cannot be transmitted through saliva, sweat or urine, and HIV does not survive outside of the body for long. HIV can be transmitted through vaginal or anal sex without a condom, sharing needles, syringes or injecting equipment.
Before the 1980s, the HIV epidemic and AIDS epidemic was considered a silent epidemic. It's widely believed that HIV was originated in Africa. While sporadic cases of AIDS were documented prior to the 1970s, available data suggests that the current epidemic started in the mid-70s. By 1980, HIV may have already spread to the 5 continents.
In 1981, cases of a rare lung infection were found in 5 young, previously healthy gay men in Los Angeles. By the end of the year, there were 270 reported cases of the severe immune deficiency among gay men. 121 men had died. In June 1982, a group of cases among gay men in Southern California suggests that the causes of the immune deficiency was sexual, and the syndrome was initially called gay-related immune deficiency, or GRID.
In September of 1982, the term AIDS, acquired immunodeficient syndrome, was used for the first time. In November 1982, the World Health Organization held its first meeting to assess the global AIDS situation and began international surveillance. The meeting has also as goal to encourage collaboration between different nations affected by this disease.
In September 1983, the CDC identified all major routes of transmission and ruled out casual contact, such as food, water, air, or surfaces. In April 1984, the National Cancer Institute announced they had found the cause of AIDS. The HIV genetic variations are discovered, making the development of a vaccination more difficult. The first European AIDS conference is held, and by the end of 1984, there had been 108 AIDS causes and 46 deaths in the UK.
In March 1985, was licensed the first commercial blood test, ELISA, to detect antibodies to the virus. In 1985, every region of the world had reported at least 1 case of AIDS, with 20,303 cases in total. In April, the US Department of Health and Human Services and the World Health Organization hosted the first International AIDS Conference. In December, the US Public Health Service issued the first recommendation for preventing mother-to-child transmission to the virus. In May 1986, The International Committee on the Taxonomy of Virus said the virus caused AIDS will officially be called HIV.
In 1987, Princess Diana opens a new ward at Middlesex Hospital for the treatment of HIV patients. She was the first person to shake hands of an AIDS patient without wearing gloves. In 1987, the UK government launched AIDS Don't Die of Ignorance, a public health campaign that came in the form of a leaflet and advert delivered to every UK household, scaring the UK public of the AIDS pandemic. In the UK advert, you can see a tombstone that has AIDS carved into it, alongside gleaming music and also a very eerie theme to the advert. Most people in the UK still remember this advert, and this is thought to have been a leading cause of stigma found in the UK.
During the 1970s and 1980s, UK also faced a scandal of the contaminated blood. Thousands of people with hemophilia and other bleeding disorders were infected with HIV and hepatitis virus through the use of contaminated clothing factors. Many people who did not have a bleeding disorder were infected with hepatitis C as a result of blood transfusions during that period. A larger number were unaware of their infection for many years of their diagnosis. It's estimated that 20,000 people may have been infected, although exact numbers are not known.
In 1990, the Black HIV AIDS Forum was set up as a response to the lack of information and services available to Black communities in Manchester around HIV services that led to the creation of BHA for Equality. BHA for Equality now remains to tackle health inequalities faced by Black, Asian and ethnic minority communities across the North West. In 1991, Queen star Freddie Mercury dies of AIDS, just one day after he announced he had the condition. Freddie Mercury was well known for his star in Queen, but also for his flamboyant personality. In 1996, the triple combination therapy, HEART, becomes standard treatment for reducing the death rate of HIV.
In September 2000, the United Nations adopted the Millennium Development Goals, which included a specific goal to reverse the spread of HIV, malaria, and TB. So, United Nations created UNAIDS, and UNAIDS led a global effort to end AIDS as a public threat by 2030, as part of the Sustainable Development Goals. UNAIDS also provided strategic direction, advocacy, coordination, and technical support needed to catalyze and connect leadership from government to private sector and communities to deliver life-saving HIV service.
In November 2001, the World Trade Organization announced the Doha Declaration, which allowed developing countries to manufacture generic medication to combat public health crises like HIV. The UK government launches the first national strategy for sexual health and HIV. In July 2002, UNAIDS reports that HIV and AIDS is now by far the leading cause of death in sub-Saharan Africa, and the fourth biggest global killer. Average life expectancy in sub-Saharan Africa falls from 62 years to 47 as a result of AIDS.
So in the 2000s, we can see a change, and 2005 was the turnaround. As you can see in both graphs, one from UK and another from worldwide, we can see a change in the year 2005, and that is due to the medication. So anti-HIV drugs that could be now a life-saving treatment. HIV was not anymore a death sentence, but a long-term illness that can be treated with medication. Awareness of HIV prevention tools like HIV testing and condom use were also key to reduce the number of new transmissions.
In July 2012, the FDA approved PrEP for HIV-negative people to prevent the sexual transmissions of HIV. PrEP stands for pre-exposure prophylaxis. In September 2014, the UNAIDS presents fast-track targets calls for dramatic scaling up of HIV prevention and treatment programs to avert 28 million new infections and end the epidemic as a public health issue by 2030. The UNAIDS also launched the ambitious 1990 targets, which aimed for 90% of people living with HIV to be diagnosed, 90% of those diagnosed accessing antiretroviral treatment, and 90% of those accessing treatment to achieve viral suppression by 2020. In 2015, WHO launched new treatment guidelines recommending that all people living with HIV should receive antiretroviral treatment regardless of their CD4 count as soon after their diagnosis.
So, and now and the future, and the all new transmissions of HIV in England by 2030. We are near this goal, and this is due to the combination prevention tools that are being used. The reduce of new infections of HIV, it's about the possibility of people accessing HIV testing and starting very early the treatment, the HIV treatment. Also, other tools like the use of PrEP is being made, and PEP made an impact of the reduce of new transmissions. PrEP was initially made available on an impact trial that ended in July 2020, and now it's available free on the NHS in England from sexual health clinics. The UK now reports 94%, 92%, and 89% of the UNAIDS targets of 1990. For the percentage of HIV positive people overall who are diagnosed, on treatment, and virally suppressed respectively.
HIV testing is crucial to ending all new cases of HIV transmission in England by 2030. By increasing testing, we can stop HIV in its tracks and make more people access life-saving HIV treatment. Prevention comes in the form of condom use, PrEP and PEP. These can be accessed from sexual health services and continues to fight the stigma against HIV.
If you need more advice or information or support about HIV testing, prevention, you can contact BHA on pash@thebha.org.uk. If you would like to order home HIV test that is free, you can order in our website, thebha.org.uk, and you can also order free condom and lube through our website, thebha.org.uk. Thank you for listening to us.
Thank you. Bye.
Bye.